Your muscles ache severely every morning, and you automatically blame your new cholesterol medication for causing all this discomfort. Your doctor prescribed a statin last month, but the daily, persistent pain makes you want to throw the bottle away. Your friends constantly warn you about dangerous muscle problems, and now you experience those exact same frightening symptoms yourself consistently. Your statin may not actually be causing the persistent muscle pain you think it is causing right now. Your daily muscle pain is driving you to stop the heart medication that could prevent your next fatal cardiac event. Your decision to quit could dramatically increase your heart attack risk without actually solving the real underlying chronic pain problem. Your exact symptoms occur 90% as often when patients take a harmless sugar pill placebo instead of statins.
This video is for educational purposes only and does not replace professional medical advice from your doctor. Statins are among the most prescribed medications in the world, reducing LDL cholesterol and cardiovascular events in millions of patients. Muscle pain myalgia is reported by 10 to 25% of statin users and is the leading cause of discontinuation. But the SAMSON trial, published in the New England Journal of Medicine, tested whether the statin was truly responsible for those symptoms. Today, I explain what the trial found and why stopping your statin without medical guidance carries serious cardiovascular consequences.
Number 2. What the SAMSON trial found. This was a rigorously designed study, and its results were striking enough to change clinical practice.
The SAMSON trial enrolled patients who had previously stopped statins due to muscle pain in a double-blind crossover design. Participants rotated through 1-month periods of taking a statin, taking an identical placebo pill, or taking nothing without knowing which was which. They recorded their muscle pain scores daily throughout each period using a standardized, validated symptom diary. The result was remarkable. 90% of the muscle symptoms occurred equally during statin months and placebo months. Only approximately 10% of the total reported symptoms were specifically attributable to the statin itself. This is the nocebo effect in action. When you expect harm, your body can generate that experience with physiological reality. Awareness of statin side effects is extremely high in the general population. That awareness itself appears to drive a meaningful portion of reported symptoms. This does not dismiss the experience of any individual patient. It means most patients deserve a more careful evaluation before stopping permanently.
Number 1. What to do next? If you stopped a statin because of muscle pain, this conversation with your cardiologist is not optional.
Every year, patients who discontinue statins have measurably higher rates of heart attack, stroke, and cardiovascular death in outcome studies. The risk of stopping a necessary statin is concrete and well quantified. The risk of tolerating minor muscle discomfort is generally manageable. There are multiple statins available: rosuvastatin, pravastatin, fluvastatin, and some are significantly better tolerated than others in individual patients. Pravastatin and fluvastatin have lower rates of muscle-related complaints due to their different metabolism and tissue distribution. A supervised re-challenge means trying a different statin at a lower dose. It is a legitimate and widely recommended clinical approach. Ideally, this re-challenge is done with awareness of the nocebo data, which itself has been shown to reduce symptom reporting in subsequent trials. Coenzyme Q0 supplementation is sometimes used alongside statin re-challenge. The evidence is modest, but it carries no meaningful risk for most patients. Please bring the SAMSON trial to your cardiologist's attention. A medication that protects your heart deserves a fair and structured second evaluation.
By the way, I covered other crucial details on this topic in my full video, The link is on the channel. If this helped you, subscribe, leave a like, and drop your question in the comments below.